we bringing care and making that available to you on your terms? What do we have to do? Continue to promote ease of service. We like to, we tend to talk to ourselves sometimes in any business and certainly in healthcare. And we, again, after years and years of targeting the boomer generation into Gen X that had a lot of, didn't have the options that we do right now, we have to make it easy. Just because someone, like I said, passes one of our facilities on their commute doesn't mean that they know exactly where to go, like when the time comes, where they need to go for that care, what website do I go to, what numbers do I call, et cetera. How can we continue to promote that ease of service? All of these things, again, I'm trying to keep very high level. These are the things that, again, as those signals get closer, we want to continue to build into 2022. So again, now a year ago, hospitals and healthcare providers became the trusted heroes. Now people expect a lot from their heroes. So this is probably, again, using that analogy one more time, the signal that's the furthest out on the horizon right now that not many healthcare organizations, hospitals have really paid a lot of attention to, which is, again, it exposed the weakness in this, employer-based health insurance and created price-conscious consumers. So we talked about convenience, an issue in healthcare that hadn't really been there in years past, growing. Cost is coming next. Care is becoming more and more commoditized, especially to the younger generation who's not loyal to a specific healthcare organization right now as they continue to age into care. Again, 85% of people believe that healthcare is more expensive now than at any previous point in their lives. And when you look at that chart on the right here, we see that, satisfaction. I'll point to the bars on the right here first, which compared to 2015 to now, satisfaction with quality hasn't dropped too much, but you see satisfaction with affordability in healthcare has fallen a little bit here since 2015. So what drove this trend? Again, financial uncertainty, care deferral. Lots of people in the last year have put off care, not only just for cost, but out of concerns for, hospitals, going to doctors, et cetera, during that time. And then number three, the political support that's coming about this price transparency on what's ahead. So sharing right now, we talk about sort of the political piece of it. Right now, hospitals, or at least in Pennsylvania, we're required to basically have a menu of what we charge for all of our procedures. What that pretty much means, what most hospitals have done have really just put this sort of, what's required by law, kind of a PDF, just a list of these different things, which is, not really consumer friendly in any way, shape, or form. But as I was talking about, no one is really doing a lot to try to push this issue right now. And we have conversations. One of the partners we work with is a national health research firm, and in discussions with them, there's no one really taking the lead right now. An example of two that are starting to move the bar forward. There's a surgical, I think it's the Oklahoma Surgical Center or Oklahoma City Surgical Center, that's really gone to a price-based model in their advertising, on their website, et cetera, really making a big deal of showing what you get for that care. And I believe it was Baylor actually did a lot of work in not necessarily trying to make their prices much more transparent, but really trying to improve what consumers are getting or what patients are getting as far as their bills. Even just starting at that certain level of making sure I can understand my bill, what I'm being charged for, what my insurance pays. They've done a lot of research to try to just make that experience a little more easy. But overall, this is, like I said, probably that light that's the furthest out in the distance. It's coming. We right now just, I think as an industry, have to figure out where we're going to go with that. What do we have to do again? Lead the transparency charge. So the next one is a year ago, as the epicenters of COVID-19, senior care lost credibility. Now winning and losing industries always attract competitors. This is the opportunity for non-traditional competitors to come into our market. Higher expectations and dissatisfaction inspired some to seek alternative care options. Not surprising when I share some of these, at least this group that we've got here in Pittsburgh, a lot of it is actually getting back to this idea of price and cost and confusion, frustration with the health insurance model, et cetera. So 20% of wealthy people pay more for direct access to their doctor compared to only 9%, and 5% of middle and low income adults. The examples that I've got here on the right are just a couple that have popped up here in Pittsburgh, which are individual facilities, individual doctors who have gone to, I think the top two are more of a subscription-based care. So completely outside of health insurance, you pay a flat fee every month, and you have direct access to a doctor, to their staff, really like text all hours of the night if you need them. They provide that opportunity to give you that more direct care that you're into. So again, kind of hitting at cost and convenience while sticking to one of the tenets of primary care, which is that relationship that you have with your doctor. So what drove that change? Again, the high deductible plans, as health insurance, as folks continue to struggle a little bit more and more with health insurance, understanding where that money goes and comes from. Personalization, again, what I want, the convenience, I want that relationship with the doctor myself. I want to feel care is tailored to me in my own way, and the provider opportunity. So again, we're seeing these folks kind of finding this niche for themselves. They want to get out and get away from large healthcare systems and go out on their own to help their patients in their own way. What's ahead? These lower price models, system-backed subscriptions, and national concierge players. Trend number 4, again, what's our opportunity? And we just have to continue to address those expectations. How can UPMC, how can health organizations around the country continue to evolve? And the biggest change, those who are driving that change, yes, millennials, am I right? So today, the millennials are 25 to 40 and make up a third of the population. They account for 21% of all healthcare spending in the US, and their usage and influence continue to grow. So millennials love wellness, but their health doesn't necessarily reflect that. This is kind of a complicated graph here on the right, but it's just basically showing, compared to Gen X, at least in terms of how they're raising their hand and they're describing themselves, millennials are actually showing that they are in a little more need of care than their Gen X counterparts a generation before. So they're out there, they're looking for care, they're struggling with convenience, they're struggling with price, and they're not loyal right now. So this is a group that needs care, isn't necessarily getting the care that they want, and looking for that on their own terms. So what drove that trend? Again, distrust for the health system, a lack of loyalty, higher expectations, and again, thinking about the experiences that other brands give to them at a very personal level. They're looking for that from healthcare. What's ahead? Increased need for care, digital first journeys, and again, that rise of the non-traditional players. How can we right now build loyalty ahead of need? This is a big area that we're focusing on right now. Another just interesting stat that we see with millennials are they're much more likely. Generations before across the country really had preference for different health systems in the areas that people were. As I mentioned, there's not that loyalty that once was, given the size of the competition, given the number of really the number of facilities and the number of locations that hospitals and different systems in their community have. That loyalty isn't there. And what we're seeing is this rise of, as we call it, no preference. Millennials right now are much more likely to not care where they go for any sort of service, any lines of care, be that PCPs, In Pittsburgh here, like I said, we have a very strong cancer, maternity program, women's care, children's, a top-notch heart, neuro, et cetera. But what we're finding is they're much more likely to, sort of look at some of these lines as commoditized, which is getting us back to that convenience and cost being key drivers of care. So again, summarizing one, health and wellness have now become synonymous. The demand for convenient care continues to grow. Consumers are questioning that value of care. They're looking for that price transparency more and more. For competitors are gaining momentum. How can we continue to address those new expectations, from 1 through 3? And really, who's driving that? It's millennials who are now entering the healthcare market. And that's it. Any questions? I think my eyesight's bad. I was having trouble reading this, so I apologize to everyone that I was turning my back to read off the large screen.
Hi, thank you so much for presenting as a non-healthcare related person. It's very interesting to learn about these things. I had a quick question if you had any opinions or thoughts on the distrust of healthcare. So I know you mentioned that during the pandemic, people turned to healthcare providers and hospitals as a source of truth and as a hero. Perhaps more recently with the vaccine, there's been perhaps a swing towards disinformation.
Sure.
And I was wondering if you had any thoughts, opinions, or just general,
It's interesting. We've seen, in my department, we measure all aspects of consumer sentiment. And what we saw with our organization and our competitors is, favorability and what they thought of our organization skyrocketed over the last years. What we're starting to see is a little bit of a decline, like a slide back to that, because what I believe is what we saw in the last year. So it was kind of an artificial high, artificial love, favorability for healthcare because it was so top of mind. But to your point, I think mandates, vaccine requirements, et cetera, are kind of slowing that down a little bit because they are, again, as she said, it was kind of like our downer look at what is truth anymore online and on social media. That has stirred the pot. The good news is what we're seeing is it hasn't dropped it so much. We still see that healthcare organizations, whether that's national things like the CDC or the World Health Organization, and even local systems, are really the top two places that people turn to for medical news. So everything is political right now. We're not immune to that, but we do see, even with some of the messaging and communications that we put out, we do see like a positive reaction to that with what we're saying. And again, everything is still political. We still see negativity when we're announcing children, can now get their vaccine. Facebook is a hellscape of comments, as we start to do that now. Hope I answered that okay.
Thomas, you mentioned 5 trends.
Yes.
Is there one trend where you think that there's the biggest opportunity for you?
It sounds like the laziest thing, and again, I'll go back to the signals. I think the closest thing to us right now, as we think about the future, is really that convenience piece, and it's really about access. It actually kind of gets to some of that distrust, like who has a lot of distrust right now for healthcare, and really sort of traditionally lower income groups. Those could be Black community in the city to rural white communities, out away from the city. Both groups are, become very distrustful about healthcare and about the information that they're getting. And one of those issues is an issue of access. How easy it is for them, how comfortable it is for them to get to their doctor, get to the care that they're looking for, et cetera. So one of our big focuses that we've already started working on, in fact, with our partners at 113, is focusing on that convenience and that access. How can we deliver care not only to everyone, but especially some of those groups that are much less trusting, of that care. So our focus next year is, education, working on not only just educating on where the care is, but making it easier for people to make that appointment. Okay.
All right, thank you so much.
Thank you so much. Thanks, everyone. Oh, yeah.
Terrific, guys. Well, this is NetBase Quid Live New York signing off. Ready for cocktail hour? Thank you so much for attending, whether you're virtual or in person. I think it's great to be back. We had some tremendous sessions today, in the morning, in the afternoon. We ended with Thomas. We have Caroline next door. Just some great stories, great insights, great experts, all sharing their information and their insights and intelligence with all of us. So thank you so much for attending NetBase Quid Live New York. If you happen to be on the East Coast and you want to sign in to NetBase Quid Live LA, it's happening next Tuesday, the 16th. So don't hesitate to think about that. We recorded all the sessions today. We'll be making those sessions live and available within a few weeks. So don't hesitate to sign in to netbasequid.com and see those sessions again. And thank you so much for attending, but don't leave without getting a beverage. Thank you.